You guys ready? Okay, good morning, everyone. Board of Control, Monday, January 31st. Will the clerk please call the order?
Good morning. Calling the roll for the Monday, January 31st Board of Control meeting. It is 11:02. Nan Baker.
Here.
Dale Miller.
Here.
Brendan Doyle serving as an alternate for Purnell Jones.
Here.
Melanie Say serving as an alternate for Mike Dever.
Here.
Mike Chambers serving as an alternate for Irma Budish.
Here.
Lee Tucker serving as an alternate for the fiscal officer.
Here.
Shankita Walker serving as an alternate for Catherine Takashi.
Here.
We have a quorum.
Okay, next on our agenda is the review of the minutes from the 24th. I'll make a motion to approve those minutes. Is there a second?
Second.
Seconded by Councilman Miller. All in favor say aye.
Aye.
Opposed? The minutes are approved. Do we have any public comment?
No public comment.
No public comment. Let's move on to our first item, please.
First item, BC 2022-60, Department of Information Technology, submitting an RFP exemption, which will result in an award recommendation to MNJ Technologies Direct Incorporated in the amount not to exceed $17,820 for the purchase of Gurok Test Rail Cloud subscription services, and recommending the award in connection with said RFP exemption.
Janelle Green on behalf of the Department of IT. This item is to renew the software for use by the real property team to track testing in relation to the Harris project. This allows the team to really understand where you had successes and failures and how to really track the movement of the project as it moves forward. This item is based on credit usage, and M&J had the previous subscription, and we wanted to renew that to have continuity for this project moving forward.
Okay, Janelle, thank you. Are there questions from the board?
Yes. Is this a matter of monitoring the implementation process on Harris, or is it a matter of monitoring the performance of the Harris system itself?
It's monitoring the implementation. So as they roll out, let's say they try to do a change into the system, they monitor how that change affects the system. And if there's some part that fails, they're able to log it here and to really be able to pinpoint where there's things that could have gone wrong. And according to our web development team, it is a critical piece that they need to continue the Harris project in order for it to move along to the deadlines that they've established.
Okay, thank you.
If I'm not
Thank you.
mistaken, you'll see an example of that in our presentation today, Councilman, the test pass and things like that. I think that's all part of the same software, so. Additional
Okay,
questions?
well, I'm willing to provide you what you need to get this train rolling down the track.
Sure. Mr. Doyle, did you have a question? No? Okay, seeing no further questions, I will make a motion to approve this item. Is there a second?
Second.
Seconded by Councilman Miller. All in favor, say aye.
Aye.
Opposed? Item is approved. Next item, please.
Next item, BC
Thank you.
2022-61, Fiscal Office, Department of Consumer Affairs, submitting an RFP exemption, which will result in an award recommendation to Nover Engelstein and Associates Incorporated in the amount not to exceed $15,250 for support and maintenance on the WinWham software system for the period February 1st, 2022 through January 31st, 2025, and recommending the award in connection with said RFP exemption.
Cheryl?
Hi, this contract, I'm Cheryl Harris from the Director of the Department of Consumer Affairs. This contract is for maintenance for existing software that we use for weights and measures. It basically allows us to get updates and technical support from the company which developed it.
Okay, thank you, Cheryl. Questions from the board on this item? Yes, Councilwoman Baker.
So this contract for $15,250 is for 4 years. It seems like a long time to have a maintenance. Am I wrong on that?
Well, we've had maintenance since we got this software. So every year we actually have to have, it's $5,000 a year contract. They only get paid annually. And it was just an effort by us to say, instead of having, 10 people touch it every year and have it go through the whole thing, let's just, since we know we're going to need it for the next 3 years, let's just go ahead and get it all together so that we can do our maintenance, because we come every year for it, and it's a $5,000, basically a little over a $5,000 contract a year. I think 5120 is what it gets to.
Okay, so it's not to exceed 5, so if you don't need it, you don't pay it?
Yes,
Okay.
we always need it because every weights and measures test we do gets automatically, like we can connect in some cases our testing. And so the test results get automatically input, and it helps us keep really more accurate records than if we were putting it in by hand. And it also lets us know what the guys in the field are doing. We know time in, time out of store, when things are, where they are through the day. It serves multiple purposes.
Okay.
But
Good.
this is just maintenance.
Just maintenance, because I just thought 5,000 a year was not very much
Reasonable.
for maintenance.
Yeah, no,
So
yeah.
just
Right.
curious. Thank you.
Any additional questions on this item? Seeing none, I will make a motion to approve. Is there a second? Seconded by Councilwoman Baker. All in favor, say aye.
Aye.
Aye, opposed? Item is approved. Next item.
Thank you.
Next item, BC 2022-62, Court of Common Pleas Juvenile Court Division, submitting an amendment to a contract with Court Smart Digital Systems Incorporated for audio and visual recording system maintenance and support services for the period January 1st, 2013 through December 31st, 2021, to extend the time period to December 31st, 2022, and for additional funds in the amount not to exceed $105,452.64.
Tamika, I think you're muted. Can you guys unmute her, or? Hold on one second, Tamika. We'll see if we can help. We able to help her? No, no. Tamika, see if you can't find that microphone. It shows that you're muted. Oh, there you go. Maybe you're off now. Are you? No, still not there. It's on her end? Is she still muted on her end? Yes. All right, Tamika, we're gonna skip this item for 1 second. Do you mind logging out and popping back in, and we'll come right back to you? Maybe it's just a connection issue, all right? Hopefully she got that. All right, let's go to the next item for now.
We might have to
Oh,
go down to
we have to go a couple.
64.
Yeah, 64.
Okay, item BC 2022-64, Department of Health and Human Services, Division of Senior and Adult Services, submitting an amendment to a grant award with Western Reserve Area Agency on Aging for the Older Americans Act Senior Community Services Program in connection with the Aging Disability Resource Network Grant Program for the period January 1st, 2021 through December 31st, 2021, to extend the time period to February 28th, 2022, and for additional grant funds in the amount of $13,952.50.
Good morning, Paul Porter, Health and Human Services, on behalf of the Division of Senior and Adult Services. This is an amendment to a longstanding grant award that we receive each year from Western Reserve Area Agency on Aging, which is funding through the Older Americans Act that helps support DSAS's Aging and Disability Resource Center, or ADRC, part of the regional ADRN, or Aging and Disability Resource Network. Funding for this grant is used to help offset the costs of DSAS operating the ADRC, and those operations include things like doing benefits checkups, events for seniors throughout the community, particularly when we're not in the middle of a pandemic. Some of those events have been delivered virtually or, more on a one-on-one client basis by appointment, as opposed to a big event at a senior center. The goal of the ADRC is to connect seniors with resources throughout the community that can help them get services they need, as well as help them save money on the purchase of services and other things. I know there were advanced questions about this one, and part of what I answered was that during prior years, so looking at kind of the 1-year period for this funding, we've been able to connect seniors to between $500,000 and $750,000 per year in different benefits, like the HEAP, the Home Energy Assistance Program, SNAP benefits, savings on their prescription drugs, and even helping them connect to the homestead tax credit, which many residents may not be aware of. So the return on investment is pretty big on this. Again, it's grant funded, so we get 85% of the funding in grants from federal Title E funds, Title III-E, which is the Older Americans Act. We're only required to match 15% of that funding, and we do that with HHS levy funds. This is going to get us through another 2 months. There is currently a grant application process for the remainder of 2022. Again, because we've had this funding for years, we did apply for funding, and we're hopeful that we'll receive it for the balance of the year as well. And that funding would come back before the Board of Control too.
Thank you, Paul. Are there questions from the board on this item? Yes, Councilwoman Baker.
I see that it's a couple months late, and for 13,000, I really wasn't going to bring it up, but given that it's ending in 2 months, is there a reason why we couldn't have got this in December or January? Is it the OAA title funds that slowed you down?
Councilwoman Baker, on this one, it was just a matter of when we were notified of the extension. I think it was in early January, and then we had to do paperwork on our end, and some of the personnel at the Division of Senior and Adult Services who utilize these funds had to submit, updated budget sheets showing exactly how the dollars would be spent. So it's really on these grant items when we're receiving funding from someone else, it's harder for us to get them in a more timely fashion if we don't receive notice until kind of late in the ball game from them.
That's what I thought. I would just check. Given it was ending, it's actually over. This is the 30th, 31st.
Absolutely. And, our goal, like I said, with the additional funding that would start March 1st, is that hopefully we'll be able to get approval on that and get it before the Board of Control in the next few weeks if we're selected for additional funding this year.
Good. Thank you, Paul.
Any final questions? Okay, seeing no further questions, I will make a motion to approve the item. Is there a second? Seconded by Councilwoman Baker. All in favor, say aye. Aye. Opposed? The item is approved. Do we want to try and go back to Tamika, or? Tamika, can you hear us now?
I am here. Can you hear me?
Yes. So we're going to go back to item number 62. So do you want us to reread it, or?
Thank you.
We already read it, didn't we?
Yes.
Yeah, so if you want to present item 62, Tamika, go
Yes.
ahead.
Thank you. Tamika Valley with Juvenile Court. We would like to request an amendment for Court Smart Digital Systems to provide servicing audio and visual recording system maintenance for our existing audio and visual recording system that's located in each of the judges' courtrooms. Court Smart Digital Systems provides annual maintenance and support of the system, and the system records all the court proceedings, such as conducting hearings, and without this maintenance and support, daily workings of the court would be halted.
Okay, Tamika, are there questions from the board? Please.
So unlike needing funds from an outside grant or other monies that we're waiting for, this is all coming out of general fund. Is there a reason why this is already 2 months late? Is it, what was the holdup in getting this
Yeah.
to us on time?
I apologize to you for the lateness of this. We are actually down one full-time employee, and I am currently trying to follow the contracts at Juvenile Court at this time. So I will take responsibility for the lateness of this contract being processed.
Okay.
Yeah, there's been some turnover over there, so, yeah.
Secondly, this was a long-term contract. We're only extending it for 1 year, or actually 10 months left. Will you be coming back for another long-term contract?
At this time, the court did not state whether they were going to be putting out an RFP for the support and maintenance of this contract, but this system has actually been in place since 2013. It is something that I can touch base on with the court to see if that would be something that would be beneficial to the court.
This looks like it's the 8th amendment. So are you continuing to do amendments, or are you going to go out for an RFP? I guess is the question I would ask, that you ask.
Yeah, I think we should encourage that, Tamika. It's going to be
Not a problem.
coming up on 9 years, almost 10 years. Wouldn't hurt to do an RFP and see if it's worth changing. It may not be, but at least you can maybe update that process.
Absolutely. I'll be happy to.
Thank you.
Thank you.
Sure. Any additional questions on this item? Seeing none, I will make a motion to approve. Is there a second? Second by Councilman Miller. All in favor, say aye. Aye. Opposed? Item is approved. Item 63, please.
Next item, BC 2022-63, Court of Common Pleas, Juvenile Court Division, recommending an award and enter into an agreement with the City of Mayfield Heights in the amount not to exceed $2,800 for community diversion program services for the period January 1st, 2022 through December 31st, 2023.
Hi, Tamika Ballard again. This is actually a city who participates in our CDP program, which are community diversion program. And what they do is they keep the children from becoming involved in the official court involvement, so it keeps them from being adjudicated. We do apologize for the lateness of this contract as well, but some of the actual villages and that we work with within Cuyahoga County have to get approval from their committees prior to them signing off on our contract. So that is also part of the reason why it's late, besides us being down a person. And we would just like to request approval for the community diversion program with Mayfield Heights.
Thank you, Tamika. Questions from the board on this item? Seeing none, I will make a motion to approve. Is there a second?
Second.
Seconded by Councilman Miller. All in favor, say aye. Aye. Opposed? The item is approved. Next item.
Next item, BC 2022-65, Department of Health and Human Services, Community Initiatives Division, Office of Early Childhood, submitting an RFP exemption, which will result in an award recommendation to Case Western Reserve University Center on Urban Poverty and Community Development in the amount not to exceed $200,000 for implementation, management, and evaluation of Invest in Children programs for the period January 1st, 2022 through December 31st, 2023, and recommending the award in connection with said RFP exemption.
Good morning, Marcos Cortez with Health and Human Services. This is a contract with Case Western Reserve to conduct evaluation activities for the county's universal pre-kindergarten program, as well as other Invest in Children programs. Those activities can be broken down into 3 parts. One is to maintain the integrated data system that is used to evaluate Invest in Children's programs. 2, they provide evaluation design and implementation. And 3, then they provide the data reporting to support our program development.
Okay, thank you, Marcos. Are there questions from the board on this item?
A question?
Yes, Councilwoman Baker.
I'm just trying to review here some of the notes. Why isn't there a year-end report? If this is an item that we're asked to support the evaluation of this service.
I'm going to reach out to Shauna Rohrman to see if she has an answer for that.
Hello, Shauna Rohrman with the Office of Early Childhood. We typically have not had year-end reports from Case Western around this contract. We have a scope of agreement for several projects that they work on during the contract term. So we submitted the final products of things that they had completed over the last year, as well as a summary of the work that they had done, but that typically has not been part of their process as long as I've been here for 4 years.
So if I may, so if it says implementation, management, and evaluation of Invest in Children programs, that doesn't include a year-end report to show what that evaluation was?
No, because they conduct several different types of evaluations throughout the year. So rather than one broad year-end report, we receive reports that are specific to those specific evaluation projects.
Okay. The Health and Human Services is where this is being taken?
Yes.
Because that's, accessible, is there a reason why it's a couple months late?
So the main reason that this one is late, it really goes back to trying to obtain a compliant certificate of insurance from the vendor. Many of the other departments will tell you trying to get a certificate of insurance from providers is almost a Herculean task. This one goes back, we started the process with the vendor back in September, the whole contracting process, but the certificate kept getting passed on from person to person within Case, and they would submit a form that wasn't compliant. We'd have to go back and forth. And we finally got one, I believe, in early January to be able to submit this contract.
Okay, just as a follow-up, in the answer of why there isn't a year-end report, thank you for submitting the summary of activities during the contract period. Does that summary of activities have any evaluation pieces to it? I haven't had a chance to look at it yet.
So the summary outlines 3 projects that where reports have been yielded, and those reports were attached to the email as well. So we had a process evaluation of our universal pre-kindergarten program to basically understand the process of how that program is implemented and use it for quality improvement. That report was completed in December. We had a focus group of early childhood providers to understand how the pandemic was affecting their service delivery. And there's a report attached for that as well. And then we're in the process of understanding how families in the county and children have utilized Invest in Children programs and universal pre-kindergarten. That project is ongoing, but the report from the first phase was sent as an attachment as well. And then the summary of activities also describes some other work that Case did that has not led to reporting yet, or wouldn't lead to a report as a final product. For example, they helped with some strategic planning around other COVID-related initiatives that we undertook starting mid-2020 to understand the impact of the pandemic. For example, a survey that was conducted of families with young children. Case Western helped with the planning of that survey, but they did not implement the survey and they did not write the report. So their involvement in that sense was more in the design and consultation of that project, as an example of what they've done.
Okay, I will certainly take a look at it. So there really isn't any outcome, any benchmarks or any comparisons from year to year to see the effectiveness of this program?
I mean, so no, probably not. No, it's how much of the scope of their services has been completed is pretty much what we would use to compare from year to year.
Okay, all right, thank you.
Okay, thank you. Are there additional questions from the board? Seeing no further questions, I will make a motion to approve this item. Is there a second?
Second.
Seconded by Mr. Doyle. All in favor, say aye. Aye. Opposed? Item is approved. Next item, please.
We're moving on to exemptions. Item BC 2022-66, Department of Health and Human Services, Cuyahoga Job and Family Services, submitting an RFP exemption, which will result in an award recommendation to RF Works Incorporated in the amount not to exceed $790,560 for a state contract purchase for the installation of wireless access points and maintenance services in 10 Cuyahoga County Health and Human Services facilities for the period January 25th, 2022 through January 24th, 2027.
Good morning, Paul Porter, Health and Human Services, working on a contract here to upgrade our Wi-Fi throughout all HHS locations in the county. Currently, the HHS agencies within Cuyahoga County operate on the state of Ohio's internet network, particularly because of the applications that we have to use for things like Medicaid enrollment, SNAP benefits, and other systems that run through the state of Ohio. Our existing Wi-Fi network throughout our buildings was installed well over 10 years ago as kind of an interim, plan to make sure conference areas and meeting rooms had Wi-Fi accessible for when people were going in and out and making presentations in those rooms. Since then, with the proliferation of new devices that are used by individuals coming into our office, clients that are in our lobbies, for instance, as well as a shift in some of our workforce using mobile devices as part of their work. Home health aides that use, iPads to record their service delivery, for instance, and then those iPads can't be plugged into a physical wired network when they come into the office. We've seen the need to upgrade our wireless system. Since we initially did our own installation several years ago, the state has made a contract with a vendor that's the only authorized vendor to provide equipment and maintenance services on the state's network, and that's RF Works. So there's an existing state contract, a master cloud services agreement is the name of the type of contract that this vendor has with the state, where the state did a competitive bid and selected RF Works to provide these services. So what's going to happen is there was already a site survey done throughout our buildings a couple of months ago. Our own public works team is going to re-cable throughout our buildings to make sure that the areas where access needs were identified have Cat6 Ethernet cables running to them. The new vendor will install wireless access points in those predetermined locations. This will provide better coverage throughout the HHS buildings than what we currently have, and also faster coverage as well. So it'll cover more areas of the building and the speeds will be quicker. And the contract is a 5-year agreement, so it'll run into January of 2027. So it covers the initial installation and then maintenance of those access points. To be clear, again, we did this on our own many years ago because the state did not have a solution identified. So they allowed us to do this on our own. Since they have a vendor in place who's the only authorized entity to work on this network, we would not be able to do these on our own. If for some reason we had been able to, the sheer costs associated with the hardware purchase and the staff time to maintain the network could very well exceed the costs that we're getting through this state contract, because again, the state competitively procured these services. I will note that this is only for the exemption for it to appear before council because it's a state contract. So this will go to committee, and we're happy to address questions at that time as well.
Okay, thank you, Paul. Are there questions from the board on this item? Seeing no questions, I will make a motion to approve. Is there a second? Seconded by Councilman Miller. All in favor, say aye.
Aye.
Opposed? The item is approved. Next item, please.
Next item, BC 2022-67, Department of Health and Human Services, Division of Senior and Adult Services, recommending an alternative procurement process to issue an additional request for proposals during the period of January 31st, 2022 through April 1st, 2022 for the Community Social Services Program, which will result in award recommendations to additional providers to be added to the 2022 master contract.
Good morning, Paul Porter again, Health and Human Services on behalf of the Division of Senior and Adult Services. We're requesting an alternative approval to be able to put an RFP out to seek some additional vendors to cover service gaps as a result of the RFP that we completed in 2021. When we entered into the master agreement for CSSP, which was just introduced at council last week and goes to committee on Wednesday, there are a couple of areas where we've identified service gaps that we want to try and get additional vendors in those areas to provide services. CSSP is somewhat unique in that most of the services are neighborhood-based. They're provided by, either a community center, municipality, or senior center in a specific neighborhood throughout the county. We've identified the central neighborhood and the city of Parma Heights as areas where we had services in the past, and there are now service gaps. In both of those cases, it's a result of a vendor who did not submit a proposal, not that we did not make an award to those vendors. So again, this would be a competitive process. We would put another RFP back out there. We assume that vendors in those neighborhoods will hopefully apply, and we may get, applicants to deliver services in other neighborhoods. We would make determinations based on, scores of those proposals when they're evaluated following our standard process. And depending on the amount of funds available, obviously where we've identified service gaps, those are our priority areas for funding right now. But this could be another opportunity for vendors in other areas, depending on what proposals we get in.
Okay, thank you, Paul. Are questions from the board on this item? Seeing no questions, I'll make a motion to approve this item. Is there a second?
Second.
Seconded by Mr. Doyle. All in favor, say aye.
Aye.
Opposed? Item is approved. Moving on to consent agenda.
Yes, we're on consent agenda items number BC 2022-68 through 72.
Okay, board members, I'll give you a couple minutes if you need it. Feel free to ask any questions. Public Works gave a good response on the underspend. Do we have any questions, board members? No? Okay, seeing none, I'll make a motion to approve today's consent agenda items as noted. Is there a second? Seconded by Councilman Miller. All in favor, say aye.
Aye.
Aye, opposed? Item is approved. Moving on to other business.
We do have other business. We have the Department of Development providing a project update on the grant award to Project Boron LLC for the construction of a cold storage facility on the Opportunity Corridor roadway.
Good morning, Board of Control members. Paul Herdig with the Department of Development. The project has received a financial award from Jobs Ohio that was acceptable to the developers for the project to move forward.
Okay.
Just
Councilwoman
be
Baker.
clear, we have a green light and we're moving forward. Is that what you're saying?
Yes, Councilwoman, the project's moving forward and our staff will now proceed to do the paperwork for the funding that was authorized by the board.
And that was 2.5 million? Is that the amount that you were able to receive?
The amount was actually not provided to me. I reported in an earlier meeting that Jobs Ohio had offered 2 million and that the project was seeking additional funding. And the information I have is that there was additional funding received that it was enough for the project to move forward.
Okay, well, thank you, and thank you for your work on this. Be an
Thank you,
exciting
Paul.
project.
Yeah, additional questions to Paul while we have him? No? Okay, Paul, thank you for the update. Good news. Any other new business or other business?
No other business?
Oh, yes, please.
If I may, I brought my granddaughter Laylee to observe today.
I was wondering who that was. Okay,
Yes,
very good.
So Laylee is 13 and observing today and will be with us for the day that I'm here.
Well, that's awesome. If you want to bring her down to fiscal, we'll teach her the real ropes.
There you go. She's going to come to finance, that'll be enough.
Okay, well, welcome. So, awesome. Any public comment?
No public comment?
At this time, I will make a motion to adjourn. Do I have a second?
Second.
Seconded by Ms. Lee Tucker. All in favor, say aye.
Aye.
Opposed? We're adjourned. Thank you.